All right, let's get started. My name is Bethany Yiser. I'm president of the Cures Foundation. CURE stands for Comprehensive Understanding via Research and Education to Schizophrenia. And I'd like to welcome Alvin Mantey tonight, who is a fourth year medical student, also doing an MPH at the University of Cincinnati. He is from West Africa, from Ghana. And fun fact on Alvin, check him out on TikTok. His channel with dancing with his twin has over 1 million views. So now I will give the floor over to Alvin. Go ahead.
Thank you so much, Bethany, and everyone. Thank you so much for being here today. A little bit of background about how this topic kind of came around. In the aftermath of COVID, the research shows that the mental health of a lot of people was in steady decline. And one of those populations was adolescents and young people. And as a fourth year medical student looking to apply into psychiatry later this year, hopefully with a focus on child and adolescent psychiatry, this is something that really stumped my heart. And so when I was in my MPH year in medical school, I wanted to do something with this and I wanted to help. And upon research and literature review, found that a lot of young people were lacking understanding concerning mental health disorders. You know, in the advent of social media, there's a lot of information on the internet nowadays. And even upon my own experience, a lot of this information is inaccurate. And so I wanted to design a project that could be used as an educational intervention to meet young people where they were, to explain mental disorders in a way that they would understand. And I decided to focus on some of the really common mental disorders that kind of occur in adolescents and in young people as well. And so I'm hoping, and it's my hope that a talk like this will be able to inform people who are dealing with these disorders or have them, and also family members and loved ones of people who have mental health disorders in order to understand the disorders a little bit more, but also to empower you to be able to make better decisions with the resources that you might have. And so, without further ado, let's get into understanding severe mental health disorders. A little bit of a disclaimer, we will be talking about sensitive topics, including suicide. So if at any time you're feeling uncomfortable or triggered, feel free to, step out. And I think Bethany might be able to let you back in or just to take a break if something is not going down well. But I appreciate your attention and let's get into it. So, a little bit of an introduction. We know that mental illnesses are health conditions, and they affect how a person thinks, feels, interacts with others, and even behaves. One of the things that I really want to address is that mental health disorders are common, and with the right kind of support and with collaborating with a physician or getting into treatment, they can be treated, and people can live very full and vital lives. Why is it important to understand? Is because there's a lot of stigma out there on social media and even within the culture. And understanding this encourages empathy and reminds people who are dealing with these disorders, or who have these disorders rather, that seeking help is a positive step. So in this presentation, we're going to cover anxiety, depression, substance use disorder, schizophrenia, bipolar disorder, and suicide in that order, with the goal of us being done in 40 minutes or less. So here we go. But first, what makes mental health disorders severe? Well, there are genetic factors that play a pretty significant role. When you look at data concerning schizophrenia, bipolar disorder, and even major depression, you'll find that there is heavy heritability in such disorders. And so if you have a primary family member who has them, the likelihood that one of the children or somebody close will have it is also high. There are also environmental factors that can make mental health disorders severe, including even prenatal and perinatal complications and, childhood adversities, and also lifestyle things that people go through, such as war and the such. And abuse in childhood as well also has a pretty high correlation. There are also some social factors such as stigma. And I found in the research that even if someone has a mental health disorder, them being around a stigmatizing environment could also increase severity as well. And there are also neurodevelopmental alterations, particularly in young people as they're developing, where early negative experiences that they have in their family or in their environment can influence the emergence and severity of mental health disorders as well. We're going to start with anxiety. Most people kind of already know within pop culture what anxiety is, but I describe it as a feeling of worry or fear or unease, sometimes about now, but most of the time about future events. Of note, you should recognize that anxiety is a very natural response to stress, and it's very common. And I bet we could all on the call think of situations in which we were anxious. For example, me before giving this talk was anxious, but anxiety really becomes an issue when it starts to get in the way of living a normal life and being able to be productive. And so, some common types of anxiety that within the world of psychiatry we see is generalized anxiety disorder, which you can describe as a constant worry about daily things and many things. Social anxiety disorder, which is a bit more niche, where there's a fear of social interactions or being judged by the people around you. And then there's an extension of that into panic disorders, which are sudden episodes of intense fear. And it's accompanied by, some physical symptoms and manifestations as well. And then there are phobias, which are really strong fears of very specific objects or situations. Some people are afraid of water, some people are afraid of spiders, something like that. Signs and symptoms of anxiety that I'd like you to be able to keep in mind with yourself or with your family members is overthinking and constant worry. Difficulty sleeping or falling asleep, difficulty concentrating, and, intense feelings of like tension and feeling restless or feeling easily tired at times. Sometimes people even get some somatic or physical manifestations, such as a fast heartbeat. They can really feel their heartbeat in their chest, or they get an upset stomach every time that they're stressed. Again, these are signs and symptoms that could show up in normal anxiety, a normal and natural reaction to stress. But when things get to the point where you can't really live the way that you want to, that's when you need to start paying a little bit more attention. Some causes of anxiety, like we've spoken about, stressful events, but there's also a genetics component to it, where if a primary family member has a generalized anxiety disorder, it is likely there is a chance that that could also be carried on through the family. Sometimes brain chemistry could be the source of it. And so that also ties into how anxiety is sometimes treated in people. But then there are also personality factors as well. Some people are just naturally more anxious than other people. And there isn't, and I'm not saying, or no one is saying here that there's anything particularly wrong with them, just a personality trait. And so, some of the ways that you can manage anxiety, whether it's coming up as part of a normal reaction to stress or is something more, is one of the things they'll emphasize in therapy is actually slow, deep breathing in the moment to kind of recenter yourself. And I like to, as I give the talk, really give an emphasis on some of the things you can do on your own outside medication, outside therapy that can be helpful, as I feel like for most people, this is what tends to empower them. Exercise has also been shown to improve mood due to endorphin release, and also having some healthy habits like sleeping well and eating healthy, limiting caffeine, especially in people with anxiety. Some people find to be very helpful, as well as just the simple talking to someone you trust. Doesn't have to be a therapist, doesn't have to be a counselor or a doctor. Just sharing how you feel might be helpful as well. And so I know some people also do this by writing in a journal, which they find helpful. Some coping techniques too is practicing gratitude, because anxiety, one of the hallmarks of it is fear concerning the future or things going now. Restructuring, or I guess refocusing your mind on to being grateful for the things that you have can, yeah, actually make a pretty big difference. And when it comes to dealing with anxiety on the daily, whether it's at school or it's a job or with a family member, break big tasks into smaller manageable steps, because sometimes it's the end goal that is anxiety ridden. But when you break it into smaller steps, things seem a little bit more manageable. And then, like I mentioned earlier, keeping a journal to write down some of the thoughts and feelings that you're having. If you're doing all of these coping techniques on this slide and managing anxiety to the best that you can on the previous slide, and none of that makes a difference, then it's probably time that you start talking to a medical provider, whether you're, PCP or primary care provider, or a therapist, or a psychiatrist as well. And so the treatment for anxiety, I want to preface that by saying that getting help is a sign of strength and not weakness. And so when it comes to treatment, you may be asked to see a counselor or a therapist to start, or or you may be asked to start a medication if you see a doctor as well. And that's completely all right. And so those are really the mainstays of treating anxiety: therapy, and then starting a medication if therapy alone is not enough. Let's move on to major depressive disorder. Oh, and I forgot to mention this earlier. If you have any questions, it'd be great if you could hold on to it until the end, just so that we can kind of get through majority of the information. And I'll be sure to flip through any slides that you might have a question about. So let's continue on with major depressive disorder, or as is well known, depression. It's a mood disorder that causes a persistent feeling of sadness, with a particular loss of interest in activities that a person once enjoyed. So, of note, it is not just feeling sad, but is actually a diagnosable medical condition that can be treated. And so some signs and symptoms to look out for is persistent sadness. And persistent is the key word there. It's not just, this situational sort of thing where something happens and then, your mood is low. If something negative happens, it's a normal reaction to have that sort of sadness attached to it. But if that sadness is persistent over weeks, over months, sometimes over years, and there's that emptiness there, that's one of the things to keep in mind. A lot of people also show loss of interest in activities that they really used to enjoy. And that's one of the key hallmarks of major depressive disorder. Some people experience a change in sleep, whether they're sleeping too much or sleeping too little, but also experience a change in appetite, whether they're eating too much or eating too little. Some people have difficulty concentrating, and a lot of people have feelings of worthlessness. Some people describe that as guilt, and most people that I see often have some form of fatigue or low energy. And every once in a while, and this is becoming more common really in the aftermath of COVID, as suicide is now the second leading cause of death among young people, thoughts of death or suicide, which is why, again, you should seek help when these thoughts are there. So why do people experience depression? Well, it approximately affects about 10% of US adults annually and tends to be more common in women and in younger adults for reasons that you might not think. Again, the research shows that it's possible that more women and younger adults are reporting it more. And so it's not to say that men are not having it or older adults are not having it, but women and younger adults are more likely to report depression. There are also some biological and psychological factors as well, disruptions in brain chemistry, stress, trauma, and even negative thinking patterns over years. There are some genetic factors as well, with a heritability estimated around 35%, which is pretty high. And, some psychological factors like we talked about, negative thinking patterns, aforementioned. How depression affects daily life. Well, I like to think of it as like, at least the best way I found to describe it and has been described to me is like dragging yourself through the day. It makes everyday tasks feel like climbing a mountain and you're super unmotivated to get anything done. And this tends to have an impact on school performance, an impact on relationships, an impact even in self-esteem as well. And so to start, you want to talk to someone. You want to share those feelings that you're having with a trusted person. A lot of people find this helpful when they can just get the words out. Another way is to also stay connected and to avoid isolation. You feel like you should isolate, but you want to spend time with supportive people and get yourself out there. Another thing that is pretty helpful that a lot of people don't think about is taking care of your body. Exercising well, eating well, getting enough rest. And sleep is one of those first things to go away when someone is having a depressive episode. So that's something you want to keep in mind. And should those things not be able to help or make that much of a difference, you want to seek professional help. You want to talk to a therapist. You want to talk to a counselor. And you want to talk to your doctors as well, because they're the people that can connect you and give you resources can provide treatment as well. And then in the meantime, you want to practice self-care. Get a routine. Wake up every day at the same time, go to bed every day at the same time, eat breakfast, lunch, dinner, have a routine. Limit social media, exercise, practice time where you can just be mindful, write down your thoughts. And if you really enjoy something, do more of that. And if you know any relaxation techniques, which therapy can also provide, you want to do some of those things too. Those are some of the lifestyle things that I want to emphasize. When it comes to getting help at the local level, there are lots of resources, and at the school level there are lots of resources as well. I believe at workplaces also you can talk to people who might be available to provide resources, such as like a counselor or somebody in human resources. I know a lot of workplaces are providing those sorts of services now, and there are support groups online as well. And so there are online resources, there are phone resources like helplines, and there are websites, there are even apps that you can download like BetterHelp. This is not sponsored, but BetterHelp, where you can talk to a therapist. There's like the Calm app where you can, so there's a lot out there that people can find to help. And so I don't want you to ever feel like there's a lack of resources here. It could always get better, but there's some pretty good ones out there. Treatment of depression. So the first line, we want to start with psychotherapy, and you'll see this running through the entire talk, that I'm always going to mention therapy. And therapy helps to deal with those cognitive aspects of depression, especially in CBT. And then when you move on from therapy, there's the pharmacological treatment like SSRIs or SNRIs, some of the medications that you might have heard of. And a combination of psychotherapy and medication is often recommended. And from my own, experience in mental health, people who do both therapy and are on medication, and I think the research supports this as well, tend to do better than one alone, depending on the situation. And so this is also one of the reasons why screening people for depression is a good thing to do. That's why when you go to see your PCP, they give you what they call a PHQ-9, which is a depression screen. All right, moving on to substance use disorder. So a couple of things first. The name of substance use disorder is relatively new. Back in the day, a lot of people used to call this substance abuse, but that kind of nomenclature was changed because abuse suggests that this person is in control and is making decisions against themselves. And we found in the research that that's not really the case. So this slide kind of outlines the difference between substance use, substance misuse, and substance abuse. And so if I could direct your eyes to the examples there, substance use would be like taking a medication as prescribed. That's substance use. Drinking coffee, that's substance use, right? And using an inhaler, that's substance use. Now, misuse will be when you take the substance and you don't use it for its intended purposes. So sharing the medications, taking extra doses, or using it for the reasons that it wasn't prescribed. And then substance use disorder, which used to be substance abuse, is where you're experiencing negative consequences as a result of that substance misuse, but then you're still not able to stop. And I say not able to stop because of this. Substance use disorder is defined as a pattern of uncontrollable urge and excessive use of a substance that leads to negative consequences for the individual's health, but then they're not able to stop. And the reason they're not able to stop is because of lasting changes in brain networks. Tends to be more commonly reported among men and younger adults and individuals with lower socioeconomic status. And an example that I put here is like using, illegal drugs regularly, developing a tolerance to prescription opioids requiring increasing doses, and neglecting the responsibilities that you have due to substance use. And so again, I want to reiterate, these people who have a substance use disorder are not necessarily choosing to go back to the substance and make decisions that may make living a normal life difficult, but there's actual changes in brain chemistry and in brain networks that reinforces this sort of behavior. That's why we call it a disorder, not abuse. So the signs and symptoms, and again, these are biological in nature. There are intense cravings. There's loss of control over the substance use. There's withdrawal symptoms when they stop, and there's continued use despite those negative consequences. So some factors that you should keep in mind. Genetics and biological factors. Yes, some people are predisposed. One person could try cocaine for the first time and walk away. Another person will try cocaine for the first time and, the rest is history. There are environmental factors as well. If a person lives in an environment where there's easy access to substances, for example, nicotine through smoking cigarettes, that's a huge risk factor. As is obvious, and availability in social settings or within certain sorts of communities as well. And then there are personal and adverse childhood experiences. As you might have already been guessing, adverse childhood experiences predispose people for a lot of issues in the future if care is not taken. And so that's also something to keep in mind, as we see a lot of children that are abused or neglected use substances or start to use them as a way to cope with stress or challenges. Treatments for substance abuse. There are pharmacological therapies. You might have heard of like the methadone clinic or buprenorphine, naltrexone. Those are some of the medications that we have to help people in treatment. But then there's also the other side of it, which is the behavioral therapy, the cognitive behavioral therapy, motivational enhancement therapy. Those are the therapies that people go to really kind of unlock what is the basis of substance use and seek to empower people to be able to make better decisions for themselves. And so doing both is helpful, is most helpful, if I can say. So some different ways to help for people who are not who have somebody that they know or love someone who has a substance use disorder. I'll get to you in a second, but the more you educate the public about what it is and the dangers and the impact of it, the better that things get. The research shows this, but also just bringing more attention to it can even, with my master's in public health, lead to policy changes that can actually make a difference. If you know someone who is going through a substance use disorder, or who has a substance use disorder rather, build empathy. Let's try and foster supportive environments within families, schools, and communities. And I know this is not easy to do, but substance use can lead to feelings of isolation and loneliness because the person needs help but might keep returning to the same behavior that's causing the problems. And so a strong support system is incredibly necessary, as it can fill these individuals with a sense of belonging and connection and make them not feel so alone in their journey. And fostering hope is a very huge thing in a disorder like this. But if you're someone who has the substance use disorder, might not be alcohol, might be other things, so don't pay too much attention to the pictures themselves, but try and make informed decisions. If you're somewhere where, whatever drug or alcohol or whatever it is present, try and say no or walk away from there. And on your own, try and cut down if you can. And again, talk to someone you trust about what is going on. Often people get into these spirals because they're not sharing what is actually going on, and people don't know that they're struggling. And here are some resources that I put there for support. There's a substance use helpline, which is national. It's available 24/7 for concerns, and it's English and Spanish speaking as well. There are also local crisis hotlines, like the Ohio Addiction Hotline, and that provides help in times of crisis 24/7. Some other resources is literally talking to your doctor or asking a family member for help. Those are things that you can do as well. Let's move on to schizophrenia, one of the most heavily stigmatized and media represented mental health disorders. So, schizophrenia I define as a severe mental health disorder that affects how a person thinks, feels, and behaves. So, an important note, it is more likely to appear in late adolescence or early adulthood. And so, early support can make a huge difference, especially when it is diagnosed way earlier on than later. And so, in the DSM criteria, the symptoms must last for at least 6 months. And I included this slide after talking to Bethany initially, just because, like we mentioned, schizophrenia is very stigmatized in media and in just in pop culture as well. And so What schizophrenia is not is weakness. It is not a bizarre personality. It is not being dangerous. It is not being weird. It is not trying to be funny. It is not being erratic. It is not acting. Okay. Some of the signs and symptoms that you can look for is hallucinations, seeing or hearing things that aren't there, strongly held beliefs that persist despite factual reproof. We call those delusions, and then disorganized thinking. That is sometimes seen when people show up for the first time, for example, to the emergency department. Sometimes individuals with schizophrenia can have a blunted affect where they can be very unreactive. Some of them will, speak less or only speak in response to others. And a lot of them will show up with a lack of motivation to really pursue things that they used to pursue. So as you can see, you can kind of get a constellation of symptoms, and you almost have to kind of tease it out, especially when you're in the hospital system, or really when you're at home and you're seeing family members. It could be that family member that everyone thinks is weird or is always talking to themselves, or that, the constellation of systems can be vast. And so it definitely requires somebody with a keen eye to be paying attention to. Where does schizophrenia come from? Well, the data shows that it's multifactorial. There's a genetic predisposition to it, as I mentioned earlier on. And there are some environmental influences too, such as like adverse childhood experiences, again, and even trauma can also spark something to happen. Some treatments now that we have for schizophrenia are involve antipsychotic medications, second generation, which are newer, better working drugs with less side effects compared to the previous generation. And then there's adjunctive therapy as well. Therapy, family interventions, and family interventions is so huge. Having a connected social network that is supportive is massive in some of the patients that I've had the pleasure of meeting in the hospital system. And again, early intervention is absolutely crucial. Okay. So if you have any questions about that, we can talk more about that at the end. Hope you guys are doing good so far. Let's keep going. Almost there. Um, Bipolar disorder. This is characterized by extreme mood swings, including very emotional highs, which we call mania, and very low lows, depression. And it's called bipolar because of the high and because of the low. It can affect relationships mostly and daily functioning. But what a lot of people don't mention on the internet is that treatment can actually help and helps manage it pretty well too. This, like schizophrenia, manifests late in adolescence or in early adulthood as well. The symptoms are an alternating periods of high energy, impulsive behavior, euphoria, and then followed by a very deep depression. And a lot of people will meet some parents and they'll say, oh, maybe, there's bipolar in my family. Maybe my child has bipolar disorder. When we talk about mania in the medical field, we're talking about like a really high. Like some of the stories we hear when somebody is manic is, they're not sleeping for like 5 days plus, or like all the way through the night. And it's not just like, oh, they're staying up and playing a video game through the night. It's like, I don't know, they're planning their next career. I don't want to, stigmatize by giving you like examples, but I'm just saying that to kind of show that these manic episodes are like sometimes they're out there, they're not like subclinical where you're like, oh, was that mania? Sometimes that happens, but that can be pretty rare. A full-blown manic episode is pretty recognizable, and then it's followed by a really deep depression. Some patients, some individuals come in with like very impulsive, standing by the side of the road, running across the road, and some even come in very hypersexual as well. But I should mention that in most bipolar cases, depressive episodes tend to be more frequent than the manic episodes. But one manic episode is enough to, have a diagnosis. So where does bipolar disorder come from? Much like schizophrenia, very multifactorial with genetic factors and a high heritability, neurobiological factors and environmental factors such as adverse childhood effects and trauma as well. Treatments, first line include mood stabilizers such as lithium. Lithium gets a very bad rap out there on the streets, but in the research, it shows that it is one of the most effective medications. There are others like it that are very effective as well, but lithium, I believe, is the gold standard. There's also anticonvulsants like valproate and lamotrigine. You don't have to remember those. I'm just showing that there are options, and sometimes the atypical or second generation antipsychotics are also used as well. And then in adjunct to that, you want to do psychotherapy as well, which can help more with coping mechanisms and building a stronger foundation to be able to handle distress. And again, kind of like schizophrenia, early diagnosis and treatment is absolutely crucial. And then, last but not the least, we want to talk about suicidality. So, a couple of facts for you: approximately 700,000 people each year globally die by suicide. There is a higher rate of suicide completion in males, but females tend to report suicide more. And now is the second leading cause of death among individuals aged 15 to 29 years, which is absolutely heartbreaking. So, understanding it a little bit more, there are some warning signs in the literature: feelings of hopelessness, talking about wanting to die. That's one of the things there. A lot of, I think there was a survey that was done, and a lot of people who have had someone in their life experience suicide has mentioned that, like, oh, they didn't know, but a lot of times the person will mention it, whether it's like a joke or passively in conversation. They will talk about wanting to die. Nowadays, even in high schools and in colleges, people joke about it. Someone does something that hurts someone's feelings, they tell them to go kill themselves, or someone will say, I'm gonna kill myself, kind of as a joke or as like a overreaction to something going on. And so it's getting a little bit harder to tease whether this is actual suicidality or it's a joke, but I would reach out anyway, and we'll get into that. Some other warning signs are: you see people tend to withdraw from social activities and kind of self isolate. Another one that you might see if you look on the internet is that people might start to give stuff that is important to them away, kind of as they're thinking through this and planning it out. And then sometimes people will also have drastic mood changes. They used to be super outgoing and super kind, but now they're a little bit more reserved. Or sometimes it's the exact opposite. They used to be a little bit more isolated, kind of on their own, and then now they seem to be taking more risks and doing things out there a little bit more. So those are all things to keep in mind. That drastic shift is something to kind of keep in mind. So, why do people become suicidal? Well, there's influence by biological, psychological, and social elements, with social elements probably being the one at the top of the list. When it comes to the biological and psychological ones, there's genetic predispositions to it that are tied to certain mental disorders. And so I know that in schizophrenia, and in major depressive disorder, and even in conditions like PTSD, sometimes you will see suicidality as a result of those mental health disorders. But then there are also psychosocial stressors, a death in the family, a car accident, an injury that prevents you from, I don't know, going pro in baseball, something like that. And people can become suicidal, or even like failing out of like graduate school, or you wanted to become a doctor and first year of medical school didn't go well. People can experience those bouts of suicidality because of some of those stressors. When it comes to treatment, there's pharmacological and psychotherapeutic interventions, again, because a lot of suicidality can be connected to mental health disorders being experienced. And so we use antidepressants and mood stabilizers and antipsychotics to help treat that active suicidality that might be going on. And the therapy is always recommended for people that are either need a little bit more understanding on where these suicidal behaviors are coming from, or just need better coping mechanisms for dealing with the stressors of life. And then, should it ever get to a point where someone feels unsafe at home, or unable to keep themselves safe at home, we recommend that they have some form of monitoring through an intensive outpatient program, or a partial hospitalization program, and at the furthest, inpatient hospitalization to keep them safe as well. when it comes to prevention, which really is the biggest form of treatment, in my opinion, the first one is education. Suicidality is one of those topics that is very like people stay away from it because it's touchy. You never know who you're going to offend by saying certain things, and most people seem to think that when like some let's say you have a friend who makes a passing comment about wanting to die, most people think if you bring it up and ask, hey, are you thinking of ending your own life, you're going to put the idea in their head. But the research shows that you're not. And you're more likely to save a life by bringing it up than, I guess, leading one to death, which is what people are afraid of. And so, my advice is if someone makes a passing comment, whether you think it's serious or not, you should ask them if they're thinking about ending their life. And if it's yes, you open up a whole channel for a conversation to be had. And there's more to learn along having that conversation. But opening that door and finding a way to get them to seek help is one of the biggest things that you can do. Don't avoid the conversation if it comes up. Another prevention strategy is seeking help. I've met a lot of people who came into the hospital of their own accord because they couldn't keep themselves safe. And that is a very mature and good decision to make. Another thing that you can do is restricting access to means of suicide. Close to 50% of suicides in the United States are completed with firearms. And so if you have a firearm at home, making sure that it's unloaded and locked away and secure could be one of the ways that you could prevent suicide as well. And then training school counselors, healthcare providers, counselors at workplaces to be able to have these conversations when people bring them up is also a huge initiative. And you also want to provide follow-up care. If someone shows up for suicidality and you talk to them, maybe get them on treatment, that's not the end of the journey. Don't just leave them to go on. Now you have everything you need to survive, right? That's not the approach that we tend to take. You want to continue to see them. You want to continue to talk to them, check on them. That's also a huge thing. And then from a public health point of view, which, I have a huge interest in, law and policy, I still believe that there are things we could do concerning gun control and a bunch of other things that could help decrease the risk of suicidality. And so, who knows, maybe in the next couple of years, some of those things will come to play in public health law as well. So, in summary of everything that we've kind of talked about, any mental health condition can be severe. Okay. There are lots of factors that affect this, including genetic predisposition and environmental experiences and psychosocial causes, and even lack of appropriate treatment when a mental health disorder is diagnosed or undiagnosed. In other words, the severity is very multifactorial and involves a very complex interaction of all of these things. And so, all of these things are something to keep in mind when it comes to mental health conditions, especially as they start in youth. Early recognition, regardless of the mental health condition, is important. And so you want to look out for changes in thinking. All of a sudden, they're not remembering things anymore. They're making more irrational statements. They seem to be more paranoid or suspicious of other people. They threaten suicide. They seem to have these beliefs that, even though factually inaccurate, they still hold on to. You want to look for these shifts in emotions, increased anxiety, increased worry, nervousness, fear, increased apathy. They're not responsive to things that they used to be responsive to. They're crying more. They have rapidly changing mood. You want to pay attention to all of these things. And in behavior as well, they're starting to withdraw a little bit more. They're not sleeping as well. They're not eating much. They're having more impulsive outbursts. You want to keep your eye on all of those things. And of note, all of those things are things that you can see when someone is growing up. When you have a teenager and they're going through their teenage years, it might be one of those things that you're just like, they're just being a teenager. But you want to stop and pause and think and ask those questions. How long has this been going on? Is it getting in the way of them, achieving the goals and the dreams that they have, of them getting along with their support system? You want to pay attention to these things so that you can catch them early on. And people for which you catch these mental health disorders early on tend to do better as well. So when it comes to treating mental illness, again, we try to take a multifaceted approach. I talked a lot about an integrated care model, that combines medical and psychological and social interventions. Those are the ones that do the best. So get them into therapy, help them to start a medication if that's what they need. Some people even opt for genetic counseling to see if, there's a chance that something might be passed on, and then address those environmental factors. The place a person lives and their environment is absolutely huge when it comes to treating mental illness, because if you take someone out of the environment and you give them the best treatment in the world and you put them back in the same environment, you might cause the issue to continue on going. And then again, I love to emphasize those lifestyle modifications: sleeping well, eating well, exercising, surrounding yourself with people you love, and having literally like having a good time can sometimes make all of the difference. And these things work. So, no matter what, I want you to remember that even though mental health disorders, treating them can sometimes be complicated, and even diagnosing them, they are very common and they are very treatable. And if you ever feel like you're the only one going through them, you are 100% certainly not alone. And that seeking help is a sign of strength, not weakness, regardless of what social media might say, or people around you or your culture might make you feel. Talking to someone about it is often the first step and can lead to some pretty great results as well. And that's it. Thank you.